The battle over health care is back. The big question now, repeal or repair President Obama's signature accomplishment, the Affordable Care Act, known as Obamacare. President Trump and the Justice Department are now actively working to toss out Obamacare wholesale. This comes after multiple failed attempts to repeal the health care law. If he succeeds, 21 million Americans will lose their private insurance or Medicaid coverage, and the health care system would be thrown into chaos. 130 million people with pre-existing conditions could lose health insurance. Joining us now is Senator Tammy Baldwin, Democrat of Wisconsin. Senator Baldwin, good to see you on this. I think it's worth reminding people before Obamacare, and you've had some personal experience with this when you were young. You and I think all of us have something that would qualify as a pre-existing condition to prevent us from getting health care. Anybody who's ever taken a tablet for depression or ADHD or ADD or something could get denied insurance. You were 9 years old and you had an illness.
That's right. I had a serious childhood illness at age 9, in the hospital 3 months. My grandparents who raised me said, let's address her coverage now. And I was labeled as a child with a pre-existing health condition, and they couldn't find insurance coverage at any price because of my previous illness, despite my full recovery. And that is what so many parents in Wisconsin and across the country were terrified about during the 2018 elections. As you know, I just was reelected, and this was the key issue in 2018, as people had witnessed the Congress voting on repeal, and then they witnessed the administration sabotaging the Affordable Care Act with various executive orders and actions. And now, of course, they're terrified about this case that's playing its way out in court. And I think that President Trump just assured us that the issue in 2020 will also be health care.
But he said yesterday the Republican Party will be the party of health care. He said that it will involve the protection of pre-existing conditions. I just don't understand it, because the federal government, the Department of Justice, and executive branch has joined a number of Republican state attorneys general to basically have Obamacare completely eliminated, declared unconstitutional, gutted. This isn't changes to Obamacare. On the same day that the president is saying that the Republicans will be the party of health care and pre-existing conditions will be protected.
Well, we need to, at this point, disregard the words and follow the actions. The action is very clear. He has, the Department of Justice is not going to defend the Affordable Care Act in court, and they want it thrown out in its entirety. So not only does that strip away health care from about 21 million Americans, but it also erodes protections that are vital. As you just mentioned, the one we talk about the most is protections for people with pre-existing health conditions. They can't be denied or discriminated against in the premium setting. But it also has many other important protections, including making sure that a parent can keep their child on their health insurance until they're 26 years old. I'm particularly focused on that one because I drafted that amendment in the House when we were originally debating the Affordable Care Act. And it also has coverage of essential benefits, things that we consider to be essential to our well-being and preventative care, et cetera.
And if I may just interrupt you there, Senator, just so that our viewers can be reminded, these are a series of benefits that under Obamacare you could not sell a policy that didn't cover. So yeah, you can get a policy that costs you less according to what Republicans want, but it won't offer you some basic coverages that everybody had to offer under Obamacare.
That's right. And even that has been sabotaged. So as we recall, last year, President Trump said, I want to be able to sell junk plans outside the Affordable Care Act marketplace. And what do I mean? Why do I call them junk plans? Because they do not have to cover pre-existing conditions. I can tell you that almost none of them cover maternity care. They are very bare bones plans. And they are already undermining the affordability issues for everyone else. So that's what happens when you sabotage and undermine the Affordable Care Act. There's many things we can do to strengthen it. Don't get me wrong, but that opportunity has been denied us for way too many years, and all I can tell you is Trump has just made health care the central issue in 2020.
Right. Just for people who don't remember what the essential health care benefits were, you mentioned maternity, mental health, substance abuse, prescription drugs, rehabilitative services, lab services, wellness services, pediatric, oral, and vision care services. I mean, these are not crazy things. These are things that we would all use. Senator, House Democrats are unveiling a bill that aims to lower cost and protect people with pre-existing conditions. Separate from that, there's a Medicare for All bill in the House. I am a little worried. You and I have talked about this many times. I am a little worried that the message is getting muddied here about what health care under Democrats, and including some Democratic presidential candidates, is going to look like. How actually do we approach what Democrats are going to do with respect to health care?
You know, I think it's pretty simple. Every Democrat I know who's running for president, every Democrat I know who I serve with in either the House or the Senate is fighting for lower costs, higher quality, and greater access. The big difference that people need to keep in mind is we have a president who is trying to take away health care from 21 million people, trying to deny people with pre-existing conditions the coverage that they need and would rely on, and has been totally ineffectual so far in lowering the price of prescription drugs. In fact, his tax plan, where pharmaceutical companies got significant windfalls, they've invested that in stock buybacks and not in lowering the price of prescription drugs that save and extend lives. So the big difference is, where would the Republican Party and this president take you on health care versus where are we all moving? Now, you know, in terms of the bold proposals that are out there, we need bold proposals and we need to debate them. But remember, the difference between the parties is whether you're taking it away from people or trying to craft bold solutions.
I remember in October and November of last year watching Republican candidates running ads about the degree to which they would protect pre-existing conditions. It is remarkable. Senator, good to see you as always. Thank you.
Great to see you. Thanks.
Senator Tammy Baldwin.